What's up, you guys? It's your boy Miguel giving you a more daily dose of your radiation. In today's video, we will be covering things that annoy your radiologist. For those who are students new to the game, just want to know about the infamous rads who are always during the nights in their Batman caves. They're never there. They're always away from the hospital. Most of the time, no one knows where they are. Sometimes we don't even know where they are. We just have to call random rooms because we don't know where the reading room is. But anyway, so here are some stuff that usually we get complained by our supervisor, because he's the one who mainly talks to the rads about any issues they're having. So, one of the biggest things, which once again, it will vary depending on your rads. If he's old school, if he's new school, different rads, different things. And depending on, your facility, and there's variables. But for the most part, our biggest thing, they want us to always have markers on everything, which it can be done, but sometimes when you're in the moment, situations, and the patient's pain, and you're just trying to get it done quickly, the extra second, putting it, sometimes it can't be done. Or if it's a trauma situation, it's kind of tight, the risk or reward to get the marker is kind of iffy, okay? And sometimes the rads will complain about certain positioning that gets done. Maybe it's not perfect, maybe it's not ideal, which, once again, you always have to put in your notes, because if you forget to put in your notes that you weren't able to properly position, they just think, you just turned in a lazy image, and stuff like that. Because they're not out there in the battlefield, out there, because some patients, depending how bad it is, well, obviously if it's broken, like, they'll know, like, it's broken, the bone got hurt, like, they understand, that's probably like the best picture you probably get, if it's broken or something. Or if it's a baby, because babies are more harder to get proper images done, because they don't understand. They're tiny, they're afraid. Another thing is the SI number, or exposure number, that comes on. Depending on where you work, you have different. Ours is called SI number, some EI number, different things. With ours, the 200 is the golden number you want to look, but sometimes it comes out 200, but it looks bad, and you have to tweak it via post-processing. So that's another thing. Your technique, your number, if it looks grainy, they'll complain about it. And the biggest issue is the big boys. That is when you'll question and see how good the tech is by the big boys you shoot and the technique you use. Sometimes they're really big, and you turn in images, and you just got to put in, that's the best I could do, and it looks grainy, aka undiagnostic, as they call it. And you're like, well, I tried, maxed out the machine. So then sometimes we bother them. Or if you send the image and you forget to flip it, or you didn't flip it the right way to make its proper orientation, that will also bother some of the rads. They will complain about that too. Let's see what else. That we're not putting our names in the notes, which you should, but even though it already gets stamped, and if you're logged in, I don't know, that's something different, I guess. You have to put in also, because I guess it's just for extra documentation, or to know who to blame. I'm not sure what that is about. They complain about that. What else do they complain about? I know for those who aren't, I really don't do fluoro, but they do complain about sometimes that the x-ray techs don't have stuff properly the way they like to, machine set up, or sometimes some of the technical stuff, or the patient wasn't properly prepared, or little things like that. They'll complain about stuff like that. Giving proper medicine, especially when you have students, you have to always be aware of, the situation, and make sure you try to, help out. Some of them are cooler to to do, work with students. They understand. Other ones are very like, I like it this way, but it'd be this way type. You gotta know. And depending who reads will determine how much of a slacking you kind of, no, not slacking, but if it's like the main radiologist who's notorious for making you to go back to shoot another one, you might as well try several times to get that better picture, because he'll put in undiagnosable or repeat images and you'll have to go back over there, which of course you should always turn the most optimal picture, but sometimes you kind of get what you get depending on the patient, or if they're aggressive, just kind of have to do that. And yeah, that is for the most part what bothers our rads at our place, Trauma 3, and I hope you enjoy your daily dose of radiation, and see you